talking about fibroids. What are they? What can women do with fibroids? We get this question a lot inside the Menopause Chicks community. Hi, I'm Shirley and welcome to MPowered. We're cracking open the conversation on midlife health concerns for women, the things that are most important to you if you are going to navigate perimenopause and menopause with more confidence and ease. Please join me in welcoming my guest today, Dr. Leila Sahabi. Hi, Leila.
Hi, Shirley.
Dr. Leila, can I call you Dr. Leila?
Of course.
Okay, great. We just met like 2 minutes ago, but it's very, very nice to have you here. And I am so glad that you suggested this topic because seriously, it is a concern and question that comes up with the Menopause Chicks community so often. And women are great at helping other women, but I'm really happy to bring in a doctor, and you must see this in your practice a lot. Otherwise, you know, you wouldn't have suggested it. So let's dive in. Let's do it. What is a fibroid?
So Shirley, fibroids are non-cancerous growths of the uterus, and it's unfortunately a very common condition that women will be experiencing throughout their lifetime. But fortunately, it is a condition that is treatable. It doesn't always have to lead to surgery or a surgical removal. It is something that can definitely be treated if it is caught, earlier. In a woman's lifetime, and it is definitely a female endocrine or female hormone related condition that I see very, very commonly in my practice. And sometimes it's very interesting because the woman may not know that they have fibroids. It is found incidentally on an ultrasound. Or sometimes when they go for another type of investigation, fibroids are found all of a sudden as an accident. And it's just very, very important to always have a pelvic ultrasound done around the age of 40 or 45, no matter what your history is as far as having children or not. I always recommend to my female patients to have a baseline ultrasound just so that you know if there was something, in the picture at the age of 46, was it there as a brand new condition or was it just developing over many, many years? So
I like that advice, baseline. I don't think it's something that we're commonly used to in managing our health. But you've also untapped a bit of a myth or misconception, because I was under the impression that fibroids, I would know if I had a fibroid maybe from heavy bleeding or from pain, but you're saying not necessarily.
Not necessarily, Shirley. It's actually very interesting because when we look at fibroids, we actually realize that many of us have fibroids. And many of us have fibroids without symptoms. So it could be a very, very silent growth within the uterus. But if you are going to, experience symptoms associated with fibroids, they're going to range anywhere from lower abdominal pain, feeling of pressure below the belly button, or sometimes it could actually be pain more than just pressure. It could definitely cause severe or mild constipation depending on the size of the fibroid, because everything is just getting compressed, and it can definitely apply pressure on the lower gastrointestinal tract. But when it comes to the female hormones, you could have irregular menstrual bleeding. You could have your normal menstrual bleeding, but it usually becomes very heavy or heavier than normal.
I've heard.
And it could also cause just spotting, breakthrough bleeding. So it really can throw off your cycle just because fibroids are a type of growth that are full of blood vessels. So as they grow and as they evolve, they can cause breakthrough bleeding without any pattern.
Now, I'm not sure if we mentioned, but you are a doctor of naturopathic medicine, and a number of our members join our community having learned that they have fibroids by visiting their doctor or their OBGYN. And they get very curious as to whether or not they should take the prescribed medication or pursue surgery. And I was really excited when you brought up this topic, because I think we are on a mission to make sure that women can get informed and then choose the journey that's right for them. So could you walk us through an example of, maybe a case study, a typical patient you've seen?
Absolutely. I can actually think of a really wonderful lady that came into my practice about a month ago, and she's around 45 years of age, and she still hasn't had children. She's hoping to be able to have a child, and she was diagnosed with a fibroid, with a large size fibroid. And because of her immense bleeding, she was recommended to have a hysterectomy. And because she had never had children, she was just really, really traumatized by the idea of having to do the hysterectomy before being pregnant. So we looked at her entire, hormonal picture, and um, basically fibroids, the way that we look at them, they are a condition that are related to progesterone deficiency.
Okay.
So progesterone deficiency is the cause or a contributing factor to the development of fibroids. And when you don't have enough progesterone, you're more likely to have estrogen. So estrogen is going to act like a growth factor. So in a woman who has never been pregnant, and basically without children, we're less likely to have that progesterone surge that we would normally experience during pregnancy. So not having children is unfortunately a risk factor for having fibroids, as well as certain races. African American women are more likely to have fibroids, and women who have started their menses earlier also are more likely to have fibroids. So again, this lady came into my practice, and she just wanted to know her options. She was given the last option as hysterectomy because the first few treatments had failed through her gynecologist. She was given a medication that stops her cycles from occurring, and basically it induces a state of menopause. And she had been on that medication for about 6 months, and she was experiencing severe hot flashes and night sweats. At the end of the 6 months, the ultrasound was done, and it actually had revealed no huge change in the size of her fibroid.
Really?
She was given another option of a medication called tranexamic acid, which is also known as Listida. So Listida is a medication that is used just to control the heavy bleeding. It will not affect the size of the fibroid. It will not lead it to shrink. But she had also tried that medication. It caused severe nausea, which is a common side effect of this medication. So again, as option C, she was told to consider a hysterectomy. And that's when she wanted to look at other options and alternatives. And then she sought, she sought answers, and she came to my practice. And when we look at her entire menstrual history, we actually find that she has had severe PMS for 20 years. She has had extremely painful cycles for 20 years. She has had irregularities in her 20s and her 30s. And she's never been pregnant. She has had ovarian cysts. So all of those symptoms and signs are indicating that she has had progesterone deficiency for 3 decades of her entire lifetime.
Wow.
So had this been diagnosed earlier, and had she maybe sought help a little bit earlier, it would have been so easier to manage.
Right.
But again, at her age, hysterectomy is really not the only answer with the failed option A and B. So what I suggested to her to start high dose progesterone replacement therapy in a form that we call bioidentical, which is deemed effective and extremely safe for women of all ages. And progesterone has to be dosed properly depending on the condition. So again, we have been doing this progesterone replacement therapy for the past 6 weeks. I'm going to be seeing her very, very soon.
Oh, good.
What we expect to see is first a reduction in the heaviness of the cycles. The fibroids will take time to start to shrink. And again, that will be a long-term treatment, but first we want to see that the cycles become less heavy. And this lady was also dealing with anemia, which is unfortunately a very common side effect of fibroids because of heavy blood loss.
Yeah.
Again,
So a couple of my friends asked me this question because they were, so one friend had a hysterectomy and one didn't last year. And the question is, will the fibroids go away if I just wait it out? I'm close, like, they were saying, I'm close to 51, I'm almost 52. Will they go away after menopause?
That's actually a really, really great question, Shirley. And actually, that's the most common question
Really?
asked because I think it's a really,
I can't believe that they'd want to wait it out, to be honest, but
there's definitely that's definitely a strategy that many gynecologists take to just watch and wait,
right,
and see what happens with the size. But fibroids sometimes, not always, but sometimes do shrink after menopause. So you could have a fibroid of a small to medium, diameter that could shrink post-menopause. But if the fibroid is of a large size, and if it is actually embedded in the lining of the uterus, it's not likely to shrink significantly. So again, the risk is that you're going to wait it out, and you could wait suffer and again experience more bleeding and become more anemic and have all sorts of other health issues. And again, a year into this period, you could still have the necessity to go through whether a surgical removal or other options.
right.
Surgery is not always the only invasive treatment. They could do endometrial ablation where they go in and they actually clear the inner lining of the uterus, and that is only if the woman will not want to have children, because that is going to be a contraindication for pregnancy.
Right, which underscores everyone's situation is always unique and different. So you need to know your options and choose the one with your health care team that's going to work best for you, right?
Absolutely. And also one other aspect, Shirley, a lot of women, they are surprised when they're told that they have fibroids. But it's one of those conditions that to me isn't really surprising. The sign of the signs of having this condition later in our lifetime is kind of written in our menstrual history. So
oh, really?
Irregular cycles for as long as you can remember. If you have been told you have cysts, if you had a hard time maybe getting pregnant, if you had severe PMS, these are all symptoms of low progesterone.
Okay.
So you have had signs of it all along, and fibroids don't just develop over a year.
Right.
They develop extremely slowly, very gradually over decades. So again, having the fibroid may come as a shock, but again, clinically, the way that I look at it, it's actually not a huge surprise because it could be a fibroid, it could still be an ovarian cyst, it could be something else. The underlying cause of it is very, very similar. We look at it as just progesterone deficiency.
It's a great segue to the question that I like to ask all of our guests, which is, what message would you like to get out to all women? And is there a certain age that you would like them to receive that message as well?
The message that I would love to get out to this wonderful community, Shirley, is that, if you look at removing the fibroid or treating that one fibroid that gives you a lot of symptoms as the end goal, you could reach that goal. You could either have it removed surgically or with some treatments it could go, but it may not really address other health issues that could come later in life. So a woman with a uterine fibroid is actually twice more likely to develop cancer of the breast.
Mm-hmm.
They're more likely, 4 times more likely to have uterine cancer. They are more likely to have ovarian cysts.
Right.
They're more likely to have conditions that are related to estrogen dominance and progesterone deficiency.
Right.
So fibroids are not really problematic in a lot of women. So they may never have to treat the fibroid, but we still have to treat what is going on internally in the body,
Right.
which is an hormonal imbalance.
And as you mentioned, you know, if you are progesterone deficient and can work with, you know, your doctor, like Dr. Leila, you're going to benefit from better sleep, better mood, right? Better brain health.
Absolutely. Better bone structure.
Better bone.
Progesterone is really
Yeah.
helpful for sleep quality, for increasing your mood, for well-being, for bone structure support, for cardiovascular support. So there are so many more benefits to
Right.
progesterone or anything that balances the hormones beyond just treating the fibroid.
I love this conversation because all of a sudden you can now turn to your fibroid and say, thank you for getting me in to see, you know, an experienced hormone balance expert, doctor of naturopathic medicine, and then benefit from all the other advantages of the protocol that's recommended for you.
I'm really glad that you look at it that way, Shirley, because that's how I look at it. Sometimes fibroids are found incidentally, but
Right.
actually a really great way to look at our internal hormone uh, you know milieu and environment, and actually we use it as a sign to really go after the root causes that
Root
we would have
cause, yeah.
otherwise missed, we would have kind of ignored or not been informed of. So again, sometimes fibroids occur for a reason, to really give us this sign to look into other hormonal issues that would have otherwise been silent.
That old, you know, the body's tapping, right? Trying to get us to pay attention. Listen, I could chat with you all afternoon. This has been amazing. We did mention you are a naturopath. You have well, why don't you tell us where your office is and how you like to work?
Absolutely, Shirley. I do work in Richmond, British Columbia, and I also have a part-time practice in Surrey.
Okay.
And
We'll put your website up here.
Absolutely. And they are actually located on my website on the contact page.
And for anyone that's listening to this interview, you know, it's probably that they have a GP, they may be seeing an OBGYN. Tell us a little bit about how you work together.
I always recommend to my patients to have a primary physician, to have a GP, because we all work together to take care of our health, and they usually will have a referral for the gynecologist through their GP. The most important thing about uterine fibroids are that we have to do the ultrasound at the beginning.
Okay.
Without the ultrasound, we cannot really confirm whether or not somebody has fibroids.
Okay.
Sometimes doctors rely on the pelvic manual exam to determine whether or not there is a fibroid, but I really don't see it as a very accurate way of detecting a fibroid. So the ultrasound has to be done. And I always encourage my patients to ask their family doctors for annual blood work, because again, if the fibroid is causing anemia, it has to be tested, it has to be detected and treated. And again, I really encourage my patients to always work with every healthcare practitioner, because every one of us has the intention to help.
Yeah.
The patient and the person, and we can all do that from different angles and in different ways, but it's definitely a collaborative effort when it comes to female health.
I love that, because we encourage women to build their midlife health team, right? So don't fire your doctor if you ever get frustrated, but look for professionals that you want to invite onto your team who have your best interests at heart and can help you get informed. Dr. Leila, thank you so much for cracking open the conversation with us today. I look forward to doing this again.
Thank you so much, Shirley. My pleasure.
Okay. Have a great day.
Thank you, Shirley.